everyone, Tom again, and welcome to the 9th Discovery Module on age-related macular degeneration from VisionQuest. In our last session, we learned about the predictable but manageable psychological aspects of AMD. We also reiterated the critical nature of a team approach, especially the integral role of caregivers. In this module, we'll visit with several people who are well along on their own paths to best outcomes. The experiences and advice they will share with us really is priceless.
For me, the first time watching my dad get an eye injection was, I don't know what the word is that I want to use, but I could not imagine a shot in the eye.
You kind of get yourself ready for it, and you give yourself a pep talk, and then here we go.
It was very scary because I was so touchy around my eyes, and I'd get something in my eye, I couldn't hardly get it out myself.
But they didn't. You feel a little bit of pressure. They're very professional about it. I had no pain. Really wasn't a walk in the park, but close to it.
It's no more than a tiny pinch.
Sometimes it burns a little and then they put more rinse in it, but there's never any pain. I never suffer pain at all.
But I have to admit that the first time he gave me that shot, I'll swear that I could see the needle coming towards my eye, and I know that that needle was at least a foot long. But then when finally the next time I came in and saw it, I realized it wasn't that long.
Of course, the first time they indicated they were going to inject my eye was, I guess you'd say, rather traumatic. You get injections in your arm and other extremities, but the eye, it seems like it's something special.
And I say it's not any different than a stick anywhere else, and I said, you always get uptight just a little bit about anything, but I know what to expect, and it's not nearly as bad as I anticipated.
As far as any discomfort, they use a sponge to deaden the eye as best they can. And the main problem, if you want to call it that from my standpoint, is when they release the drug in your eye, there's a good deal of pressure, and it's not really what you call painful, but it is uncomfortable.
It has gotten better and better over time, and it's faster, and it doesn't bother me at all now. I just come in when they say, and go through the gamut each time, and it's really helped my eye.
After my eye injection, I have a little discomfort at first. It takes about 3-4 days before I'm real comfortable with it, and then it clears up.
Now, the Vision treatment, I call it house arrest. We have to stay in the house, we stay out of the sun. That's the most important thing. And it isn't that bad a deal, really. It's just the confined part, to stay out of the sun.
I don't enjoy that because I do like to be outdoors once in a while, and it is kind of confining, but if I never have anything any worse than that, I'll be lucky.
No, there's a definite improvement in vision, and it has been well worth the trip and making the effort. This, again, we come frequently with treating both eyes. It is a frequent trip to Wichita, and so it's a 40-mile one-way trip, and so there is some scheduling issues and things that we have to work out, but it has been by far very much worth it to make this happen and keep it happening.
My son brought me the second time that I came in, and he just couldn't imagine me going through eye injections. And he came in, brought me in, and he sat through the whole thing, but he just really shaking his head, and he didn't have too much to say. Well, the next time that I came in, I expected him to get up and come in with me when they called my name. But instead, he had brought a movie and went back out to the car and sat and watched a movie while I went through it. So once was enough for him.
As my dad's caretaker, I don't resent having to come up here every 6 weeks or taking him, you know, he had eye surgery or any of that. I think it's just built into me that I am the caretaker and it's my turn.
I think the benefit is worth it, and it's no problem for us to come in. In fact, we go out for dinner. It's just kind of like a date for my wife, that we go out for dinner and then go back home.
By the time I get home, which is 100 miles away, I'm able to just like any other day. I'm seeing good, and the pain is gone, and I can just take over and do my activities like I should. It's just a blessing that I've got my doctor and assistant to take care of me like they are.
So, what we've learned together is, again, that many good people have navigated a course with the diagnosis of AMD as their starting point. Patients with AMD, both wet and dry types, are generally very willing to share their experience with others. Fortunately, many of the assumptions associated with the treatment of wet AMD are simply false. In Discovery Module number 10, we'll gain valuable insights to reach our destination: best outcomes. Tips and strategies developed from years of delivering subspecialty retinal care will be presented. I predict you'll see that the material we've considered together in these Discovery modules is really steering us to our target with great accuracy. So make sure to join us, and remember, keep a steady heading and stay the course.